right. So Dr. Ong, thank you for joining us from Chicago. You're in isolation there. I'm in isolation in Scotland. But for the purposes of communicating to our audience, can you give us a little bit of background about your expertise in narcolepsy and specific references to your current research?
Sure. So I am a clinical health psychologist by training, and I specialize in mostly behavioral interventions and treatments for sleep-wake disorders. We now have a certification, a board certification, so I can call myself a diplomate in behavioral sleep medicine. To kind of recognize the specialty. But anyways, what I've been doing with narcolepsy is primarily focusing on the psychosocial impact of narcolepsy, health-related quality of life, and different ways to improve that. So we've taken a series of steps from first just learning from narcolepsy patients and people with chronic hypersomnia, what they're going through, what type of needs they have that aren't being addressed, in the current healthcare environment. And one of the things we really identified is that there are mental health services, but a lot of times the mental health providers don't quite understand narcolepsy or hypersomnia. And then a lot of the healthcare providers, sleep doctors for narcolepsy don't have the time to spend on addressing mental health issues. So there was this gap. And so we've been trying to kind of fill that gap by first understanding the needs and now trying to develop some interventions using cognitive and behavioral strategies. And also we have a project that is coming online soon looking at mindfulness meditation is also another strategy to help people mainly cope with symptoms of anxiety, depression, and improving the health-related quality of life.
Yeah, that's very relevant, isn't it, to some of the needs people have with narcolepsy on the mental health side. How do you see that being applied to the kind of clinic side of things when they go and see their doctor and they've got this, enormous impact of narcolepsy on their psychosocial life? How do you see what you're trying to do kind of impacts that clinic environment?
Yeah, so we see what we're developing as really an adjunctive or a complementary service to what they're doing. So it certainly wouldn't replace going to a sleep doctor. That's still very important. Wouldn't replace taking medications or any other medical care. This is something that we see that would happen above and beyond that. So it's to connect people with some services. In some instances, we're trying to bring people together as well. And one of the nice things is that when we started this, we realized that because there aren't right now too many people that do behavioral sleep medicine, we wanted to try to bring in some technology. So we've been doing mostly like telehealth. So a lot of this is actually remote, which certainly fits what we're going through right now. And even our early research, we did it online. We did use live video conferencing platforms like Zoom to try to reach out to people with narcolepsy, because many of the people that we've come across, they may not be in a big city. They may not be in a place where there is a narcolepsy clinician, or at least a specialist who understands narcolepsy very well, much less someone who understands the mental health aspect of it. So we wanted something that could really improve the outreach and connect people. Some of the things that we learned in my other work on insomnia, which is that we had a good product that we developed, but then we didn't have enough providers to disseminate it. So here we were trying to bring in some technology to try to address that up front. So the hope is that as we get these research projects launched, and hopefully there's evidence that they will be helpful, people can connect online using these live video conferencing platforms, and maybe also some digital products like apps and so forth that kind of help people on a day-to-day basis. We've got some projects in development on that as well.
Yeah, they sound really exciting. I know we talked a little bit about apps last year, but before we get into that, what are some of the kind of specific areas of mental health that you've looked at in your studies? Like, what were the questions people will ask, assuming it was a kind of survey-based research?
Yeah, so our first steps were just, to kind of understand the needs. And, a lot of it centered around depression and depressive symptoms. In some cases, it was distinguishing what were the symptoms of narcolepsy versus depression itself. It's very difficult. I mean, even well-trained clinicians and doctors oftentimes have difficulty distinguishing that, which is one of the reasons why it often takes people with narcolepsy so long to get diagnosed. A lot of people think initially it's just depression. So that's a question that we hope to tackle a little bit later on, but those are some of the things that came out. Now, for what we're doing in many cases, what we think we can help people with is that ways to try to regulate emotion, regulate mood, really regardless of whether or not it comes from narcolepsy or depression. We think some of these strategies can be helpful just as general mood regulation strategies, and with consideration of what people with narcolepsy are going through. So,
and just to be clear, sorry. Yeah, just to be clear, was it an adult survey, children, pediatrics? What was your demographic in terms of research?
Yeah, so we started off with adults. I think 18 and over is what we were targeting, mainly for just reasons such as, like, with our ethics committee, it's always more challenging to deal with children. Also, one thing we learned along the way is that in the US, some of the regulations for when people can actually consent to doing research projects, that actually changes across different states. So we didn't realize that until we opened this up to nationwide surveys and recruitment, that in certain states, it's actually 21 or 19 rather than just 18. So for those reasons, we started off with adults, but we'd love to eventually look at children, adolescents, because that's certainly an age group that's in need. So we see this as just a starting point, but hopefully we can expand from here.
Yeah. To what extent in your research kind of has the impact of isolation kind of appeared? Because now we're obviously wanting to talk to you and explore, this new scenario that everyone's facing and how potentially that will impact narcolepsy symptoms. But have you come across isolation before in people with narcolepsy? Is it an issue that needs addressing?
Good question. I mean, certainly there have been some people that we've connected with where either they don't feel like they have the social support. I think when I think of the isolation, it's usually along those lines. In some cases, the isolation might be where they feel that they haven't found a sleep doctor that really can adequately address their needs. So, prior to this, the COVID-19 situation, I think the isolation was more from just a feeling of not being understood, the feeling of being alone. I think other things where when they try to tell other people about narcolepsy, their diagnosis, that people make fun of them or they don't really understand. So it's more of a sense of isolation. I mean, now we're physically isolated. So, it might even be harder to get access to care, in some cases, harder to get access to social support as you might normally do. Now you can't just go over to somebody else's house or hang out in a park. Like here in Chicago, they actually shut down the lakeshore because too many people were trying to, go out and go for a run or a bike ride, and they weren't practicing social distancing. So that certainly can make it more challenging right now to connect. And generally speaking, as humans, when we feel more socially connected, usually our mental health is better. So being isolated with the self-quarantine and self-isolation can certainly challenge that.
Did anxiety play a part in your research?
Yeah, definitely. I'd say that's probably the next major category. In different ways, I think a lot of people are anxious about, like, can they function the way that they would like to? In some cases, like people with narcolepsy type 1 who have cataplexy. I can recall this one person who was telling a story about being in a certain place on campus. This was a college student where she had a cataplectic attack and then became very, very anxious and very scared about going back there. So, something like that can actually develop into something like a social phobia or avoidance of a place. And generally, when people start avoiding due to some kind of anxious response, that tends to snowball where they could actually develop a stronger anxiety reaction. So
yeah, it's interesting. We don't know how COVID is going to impact people long term, but what would you anticipate that looking like in terms of isolation, depression, and anxiety? Kind of we're a few weeks in socialization, lockdown here, lockdown there, where you are not really knowing exactly what the timeline is. What do you think the impact more long term might be on people with narcolepsy?
Yeah, I mean, I think there's certainly the uncertainty that we're all dealing with right now. I think that also with being away from, our school, our work, it can throw off our routines. And I think, for people with narcolepsy, one of the important things that we've tried to emphasize in some of our intervention programs is having a structured routine. Whether it's taking medication at the same time, taking naps at the same time, mainly because then your body and your mind have some expectations. And I think when people are at home and they don't have those, normal things in place, it can throw off their routine. And a lot of times once you're off your routine, then it's easy to feel lethargic, and sometimes the motivation decreases. For people with narcolepsy, sometimes they get caught up in other things, but the brain fog could even be worse. And so I think it could be an exacerbation of their symptoms. And in terms of long term, if this tends to persist, then those symptoms can get even worse, and it might even be harder to get back into a routine and establish that structure.
Now, earlier you talked about the importance of telehealth. Thank goodness that was emerging anyway through your research and other researchers who are pursuing similar lines of inquiry. But even now it has more of a role. How do you feel like that would work with the apps? Can you tell us more about some of the technological aspects of your research that are developing in a way that might be positively impactful in the short term now that we need it so much?
Yeah, it was more of an opportunistic thing. When we started this, that we just realized that we thought telehealth and these digital ways to connect would address some of the accessibility issues that people with narcolepsy were having. Not just that they were distant, we've talked about that, but also just the challenges of even driving to a doctor's appointment.
Right.
So that was really the reason why we started this. But in the current situation, I think it's become even more useful. We can really conduct all of our research remotely. So, we can still do our research while social distancing. I think, some of the opportunities that have come up are finding creative ways to connect. In some of our research, we've had groups for our interventions. And I remember in that, in several of the groups, participants had commented that they had never actually met somebody else with narcolepsy or hypersomnia. So I think, there's opportunities like that where, like the current situation, with a greater emphasis on telehealth. And I think also just people seeing that, you can actually deliver telehealth. It isn't detrimental. And, even physicians who can, in some cases, do some aspects of a physical exam remotely. I think it's diminished some of the, the not necessarily stigma, but just sort of the initial pushback of why we can't move forward with some of the technology. And I know like some groups like Wake Up Narcolepsy, I believe, has like some support groups. So I think, this focus on using different ways to connect, creative ways to connect, I think could be a silver lining that could come out of this. And then I think other areas like with apps and so forth would just be another way to reinforce some of the structure, reminders. With one of our research projects right now, we're trying to develop an app that can actually help people track and remind them to take medications to keep that structure in place. So, I think with some of the technology that we can do remotely, that can certainly help in times like this.
Yeah, I remember you talking about the app last year. When might that come to market? Because it sounds like it will help with the structure, with the routine, keeping naps as well as medication kind of right to the moment. So when might people be able to access that app? And what's it called?
It's a secret right now because it's in development. So I won't reveal the name yet. And we haven't finalized that. So we're working on it. In fact, we just had a meeting earlier this week to talk about some of the organizational aspects, the functionality of it. So we're really excited about it. Our timeline is to try to have it out probably by our original timeline was towards the end of the summer, around like August or September. It might be delayed a little bit, but so right now we're still going through the design phase. We then want to do a little bit of kind of beta testing, giving it to a few people in the community to just see how they like it, see if we can fine tune a few things, and the idea is that this would be something that would be freely available to the narcolepsy and hypersomnia community. So I would say look for it maybe late summer, early fall. We'll make sure that we make some announcements so that people can use it. And I would say we also see this as a first step. I think the first version should have these tracking capabilities, the reminder capabilities, because we see that as kind of a core, and then we hope to be able to build on top of it. We got a little bit of money to get this started, and our hope is that that's more of a seed money, that it can then lead to other projects, both in terms of developing the product itself and, as being more of a researcher. With my background, we hope to test it just to see how it can be useful, who it can be useful for, and so forth. And again, I think the ultimate vision is that this would be something that could be complementary to their current, sleep doctor's care. It wouldn't replace it, but I think it would be something, especially for people who, might be seeing their sleep doctor, and maybe their sleep doctor could say, okay, here's your medication, here's when you should come back. But in the meantime, you can also use this app. It's something that can help you on a day-to-day basis. So the idea being, an app can get into people's daily lives. Whereas I guess as healthcare providers, I mean, we can, we usually see people every once in a while, whether it's 1 or 3 months, something like that. But we can't get it be in there, every day and keep reminding them. So an app has the opportunity to do that.
Yeah, we'll be sure to share that with our audience. It's very exciting. And as you say, something tangible, something every day that people can access. Now, I know that you're a specialist in mindfulness, and that means a lot of things to a lot of people. But from your perspective, what does mindfulness mean for the person with narcolepsy?
Yeah, just in general, the concept of mindfulness, at least in the way that we usually use it, is simply focusing on the present moment, being fully aware of what's happening, but to do so in a certain way. And that's in a place where you're not using judgment. You're not trying to do this to improve anything. Mm-hmm. So there's this concept of a non-attachment to outcomes. So the idea is that you're just paying attention to what's happening in the present moment and just watching each moment unfold. And as you do this, even though the intention isn't to try to make things better, oftentimes you can start to see things more clearly. It's easier to let go of certain reactions, certain attachments, like I want it to be better. I really wish we could get back to being out of social isolation, things like that. And so there can be some benefits in terms of reducing stress, reducing anxiety and depression as you practice this. But it's not easy. It's an easy concept to understand in some ways, but it's difficult to practice. And then that's why mindfulness usually involves a practice of meditation. So the meditation is a time that you set aside just to be present. And that's really what mindfulness meditation is. And then there's now programs that are really worldwide now where they teach people how to do mindfulness meditation practices, how it can be applied in certain areas. Generally, these are kind of just educational classes that's not specific to any particular population or condition. And what we're trying to do is take that core mindfulness class, it's called mindfulness-based stress reduction, MBSR as it's popularly known, and then try to see how we can adapt it to help people with narcolepsy manage their symptoms, manage depression, anxiety that can come about, as they're trying to deal with the symptoms of narcolepsy.
So with meditation, if someone wanted to just start as a beginner now because they find themselves, more anxious than normal and with a bit more time on their hands potentially, would you recommend any resources specifically that is specific for meditation?
Yeah, so typically it's easier to start with a guided meditation. It's that's usually where you're listening to something where there's a voice that's guiding you. For example, focus on your breathing, just being aware of what's what's coming up for you in your mind and then your body. And there are a lot of different programs for that, certainly online. There are different apps. The two that probably come to mind most are Headspace and Calm. Those are the two most popular mindfulness meditation apps right now. And I think they do a good job of just providing a nice introductory sessions and meditations, many of which I think you can access for free. I think if you subscribe to them, then you can get access to more content. I'm a little bit more familiar with Headspace, just to be quite honest. And one thing I like about Headspace is that their their meditations, at least at the beginning, are quite brief. They have these 10-minute meditations, and I think their focus was to try to make it more digestible to the beginner. Someone who maybe can't start off meditating for 30 or 45 minutes. And I think in the case of the narcolepsy community, it probably would be difficult to do a longer meditation, but maybe a brief meditation would be something that they could start with. And then from there, one of the things we're exploring in our research is to see if other types of meditation that don't involve just the sitting quiet ones, like movement meditations, other things like Tai Chi and so forth, those are also ways to incorporate mindfulness into a meditative practice, that maybe those more active meditations could be something that the narcolepsy community could use a little bit more.
Yeah, I'm just interested, like the best time of day for a person with narcolepsy to do meditation, because it makes you sleepy and they're already sleepy. So is it best from an anxiety point of view to do it during the most wakeful times of the day, or to use kind of as a sleep aid?
Mm-hmm. A good question. I mean, I can't say I have any data, to support my responses now. So I would say, just based on my experience and some anecdotal evidence, probably when you're starting to learn this, it would be at a time when you're alert. So it would be easier to focus, and so easier to kind of, see how mindfulness meditation works, try to understand some of the principles. I think once you get the hang of it, then you might be able to apply it and to do it in more challenging situations, like when you're feeling really fatigued, or when you're really anxious. Mm-hmm. So, what we often tell people is, much like if, I was a coach for a football team and we're designing a new play, we wouldn't try to implement that new play in the middle of the game. We would try to do it on a practice field first. So a lot of times when you're trying to do something new or changing a habit, you want to start by doing it in a situation where it isn't, the most intense or the most challenging. Do it at a time where the stakes are lower. And once you get the hang of it, then you can start to apply it in more challenging situations.
Thank you. I know we talked a little bit about your research at the beginning, but what's happening now and how can people participate and kind of join you really as we try and push forward these boundaries of anxiety and depression and looking at the psychosocial aspects of narcolepsy?
Right. So we'd love for people to join us. The project that we have that's really close to getting online and open for recruitment is the project on mindfulness. Basically, what we're doing here is we're taking that MBSR class I mentioned earlier, the mindfulness-based stress reduction class, and we're testing 3 different versions of it to see which one is going to be most feasible and most acceptable to the narcolepsy community, for people with narcolepsy. Because the standard program is an 8-week program where it's 2 hours long, and it involves a lot of quiet meditations as well as movement meditation. So we're not quite sure that people with narcolepsy would be able to do well with that standard version. So we have a short version, or we call a brief version, that's more of a 4-week delivery. We kind of squeeze everything into a shorter period of time. And then we also have an extended version, which is stretched out across 12 weeks. That makes it a little bit slower pace and gives people an opportunity to practice, as well as we have these office hours where people can actually have a consultation with the meditation teacher who's leading these classes. I should say that all of these classes are held online, and they're in small groups, so we anticipate about 4 people per group. So again, the nice thing is that this is open to people across the country. Unfortunately, right now it's limited to just people in the U.S. That has more to do with just kind of an ethics thing that because our ethics board is concerned that they're not sure about the regulations internationally. They wanted us to just focus on the U.S. Hopefully, we'll be able to expand beyond that. So that's a program, and then the screening process consists of mostly questionnaires and a brief interview. And part of this is just to make sure that the person's real, as that's one challenge with online and digitally based interventions, is that every once in a while we come across a bot or somebody who's trying to just make money and keep repeating their participation. So we also want to make sure that people do have established care for their narcolepsy. They're on medications. Again, because this is not meant to be a substitute for their narcolepsy care, and because people are spread out across the country, we want to make sure that they are connected, and this is, again, an adjunctive treatment on top of that. So that's kind of the setup, and what we're looking to see is if this can actually improve some of those symptoms of depression and anxiety that we talked about before, and can it improve their quality of life, and really their ability to manage their symptoms, ability to feel like they can engage in their life, what we would call self-efficacy. So what I can say is that we're really close to launching everything. We're just going through some final dress rehearsals. We need a final approval from our ethics board, which we hope will happen here in the next couple of weeks. Right now, since we don't have full approval, we can't fully advertise, but what I can give you guys is that there's an email that you can contact us where we could at least start a list. So the name of this project is Ascent. So it's ASCENT. Stands for Awareness and Self-Compassion Enhancing Narcolepsy Treatment. So the email that we've set up for this study is ascent@northwestern.edu.
And we'll be sure to include that in the rhetoric and the language around this interview. And it opens in the next few months, you said, so people
hopefully the
keep
next
an eye
few
out
weeks.
For that.
Yeah.
Oh, okay.
Yeah. Originally, we were
Excellent.
hoping to launch by April 1st, but given some of the coronavirus situation, that's been delayed a little bit. But we're hopeful that we're not too far away. So hopefully in the next few weeks.
Okay. Well, thank you for that. That's so helpful. I'm sorry I won't be seeing you in June. I think we were supposed to meet, but hopefully in the not too distant future, we will be able to catch up, and you can share your research with Wake Up Narcolepsy. And thank you also for being one of our medical advisors on our board, and one of our researchers that we're just so delighted to support. So thank you. Do stay well, and your family also.
Likewise. Yeah, likewise. Same to you, Claire.
Thank you. Bye, Jason.
All right. Bye-bye.